station. This is Bobo FM. The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Hello, Cayman, and welcome to another episode of Healthcare Today with the HSA. I'm your host, Austin Harris. My guest today, it is a pleasure to receive in studios, Dr. Lundie Richards, and together we will discuss another exciting service provided by the HSA. More specifically, we're going to talk about their Haematology, Oncology, and Chemotherapy Centre expansion. So with that, a lot of information to cover. And without any further ado, we'd like to welcome our guest, Dr. Lundie Richards. Dr. Richards, a pleasure to have you with us in studio.
Thank you, Austin, and good day, and thank you for having me.
An absolute pleasure having you as our guest in studios. Before we begin and, get off on the topic itself, maybe you can tell our listeners a little bit about yourself, your background, your specialty in particular, so that we can get a feel for who the man is behind the stethoscope, so to speak.
Yes, thank you for that. I'm Lundie Richards. I've been one of the hematologists, oncologists here for at least 5 years now. And we specialize in blood diseases, which is basically why the term hematology, and oncology looking at a raft of cancers. And so one of the main things we do is administer chemotherapy. Therein lies the name Haematology, Oncology, and Chemotherapy Centre.
Gotcha.
Traditionally, people used to just think of us as oncology and cancer care. And but we are much wider than that, and that's where we have changed nomenclature to fit exactly what we do. Look after patients with various types of blood diseases, from bleeding disorders to low blood counts, as well as those with cancers. And we administer things like chemotherapy, immunotherapy, and other drugs like that to treat different conditions.
All right. Thank you, Dr. Richards, for that. Now, I understand the HSA plans to expand their existing Haematology, Oncology, and Chemotherapy Centre. What inspired that move?
So that move it's because of the people. We have been growing for the past 5 years, and we keep growing. And just the numbers tell us that it's much better to just increase our physical capacity to accommodate people. And more often than not, we have a number of people who we schedule them to have either chemotherapy, immunotherapy, or some kind of treatment administration. But because of the originally small space, then patients are pushed back a day, 2 or 3. And sometimes that can impact on their actual treatment. And so we're expanding the number of spaces to facilitate as many patients as possible in any one day. So that was the first thing. The second aspect is to make the environment more comfortable and sometimes as private as people want it, because some people want to be a little bit private. Yeah. So we want to do both to satisfy our clientele.
Now, you certainly sought to answer this next question a little bit You sought to answer this question in your opening comments, but maybe you can expand on it a little bit. How does the center currently serve its existing clients or patients, and how will the broadening or the expansion complement these existing services?
So, we have a wonderful staff who are very, very accommodative. And we see patients on a daily basis. They're all scheduled to come in for either to be seen by the physician or to come in for a procedure. Now, the current space that we have, it kind of limits the numbers of persons that we can see on any one day. And so as we expand, this will therefore increase our capacity. The new center will have the proverbial all the bells and whistles to make sure that people feel comfortable, they feel, because especially those persons with a cancer, and cancer can be a traumatic, psychologically traumatic and physical thing that someone could have. Sure. And you want, when you come in, the physical space, you want to feel as comfortable as possible. I mean, I know that our staff are exquisitely careful. They're very patient-centered, so we understand our patients. And so we look at each person. No two people are the same, so we know how we manage our patients. But giving them that more space, and with all the bells and whistles, as I said before, we'll have greater comfort and people will feel much better coming, and we can serve a greater number of persons at the same time.
Indeed. Now, the center is broken down in three parts: hematology, oncology, and chemotherapy. When we think hematology, normally what comes to mind is drawing blood, getting a blood test or otherwise. But oncology and chemotherapy are rather specialized treatments.
Correct.
Certainly, any of our listeners who's ever had a family member that's had to undergo chemotherapy, you know exactly what I'm talking about. It is very specialized in unique treatment. How will the expansion specifically benefit those specialized treatments?
Okay, so for those specialized treatments, we will be much more able to have automated systems in place to fit into the actual treatment areas to make sure that everything goes through much more smoothly. So as the medications are prepared, then we be able to transfer and get these administered as quickly as possible in the safest manner, right? So that is absolutely critical to our patients.
All right. Now, I know it's still very much in the works, but are there some key features outside of the aesthetics that we spoke about, making the patient feel comfortable and relaxed, and certainly in the right environment for both the physician and the patient in which to interact? But are there any key features of the new facilities either being added or upgraded, whether it be the inclusion of a new monitoring equipment or et cetera, that will be added as part of the expansion?
Yeah, one of the things that we're doing, we're putting in a new software system. And this new software system will make our work even more automated and tamper-proof and safe for our patients. And we'll have the automatic callback system for automatic scheduling. Yeah. So these things are we don't normally see it at the front, but in the back end, as you alluded to with your equipment earlier on, these make everyone's lives much more comfortable. So this new software system is going to be critical in terms of assisting us in terms of our ordering, drug preparation, documenting, and creating that kind of signature trail along the line. All of these are going to be very important for our patients.
You mentioned earlier, and I'm delighted to hear you say it, that the ethos of the HSA, whether it be hematology, oncology, chemotherapy, or any sector, is patient-centric or patient-centered. How was the approach to expand your existing center developed with that in mind, with the patient's view in mind?
We have a very close relationship with our patients, and we listen to them. So when they come in, we don't automatically just run and say, okay, let me listen to your heart. We have a little icebreaker. And how you're feeling today? How was the service today? is there anything that could make life better? Those simple questions, put it in between. And sometime off the fly, the patients themselves will make suggestions. Oh, I wish it was like this, and I wish it was like that, and so on and so forth. And some of these things that the patients have mentioned have come into play. Or they may say, Doc, I wasn't so comfortable with A, B, and C. And you recognize, we could make some of these changes to facilitate our patients. So these changes we're making, not only because we have seen from our end, but we have gotten either direct or indirect feedback from our patients.
In the old days, and I'm no longer spring chicken, so I can say the old days now. But in the old days, generally in the operating theater, surgeons in particular would like to, play their own choice of music, some form of audio whilst the procedure is being conducted, and that is designed more so for the benefit of the technicians than the patient, because the patient is obviously anesthetized and doesn't know it's happening. But in today's world, particularly in specialty treatment areas, there is the added value add of audio visual aids, again, designed to make the patient feel more comfortable, to remove anxiety and stress. Is this a feature in your expansion?
It is definitely a feature. And so there are going to be two parts. One in which you could have just a general audio visual, but not everybody like every single thing.
Right.
And so we'll have it personalized. So every bay, as we would call it, that a patient is sitting, they can manipulate their own things to make sure they're comfortable. So you have all these, as I call it, the bells and whistles,
Right.
in terms of audio visuals that will make people more comfortable, educational, right, soft, and so that it really is a total welcoming environment.
Indeed. And this is not just, again, an aesthetic. There is actual scientific evidence that these audio visuals, whether they to help reduce anxiety or stress, but they do actually provenly help to relax the patient. Yes?
Yes, they do.
They do. Another big question that comes to mind whenever there's an expansion and introduction of new services, of course, we're delighted when we have all the bells and whistles. But really, from a patient standpoint, the thing that I think ranks number one on our mind is how long will I have to wait for my appointment? How long or how difficult will it be to make an appointment to see my specialist? Talk to us about wait times, appointment times. Have these things been factored into the patient-centric expansion of the center?
Yes, we have factored that in. Well, firstly, I must tell you that with our center, the wait times is no more than 2 weeks, right? Which is relatively quick. And we want to make sure that the wait time is less than a week, if at all possible. No, that is general to see the physician. Now, in when all is said and done, the treatments have been approved and so on, then we want to make that wait time for treatment administration less than a week, right? And that's where I say we fit in as many patients as possible without people crowding over each other in any one day, because we'll have more staff and more space and more bed space actually to administer treatments.
Speaking of that treatment administration, using the current model or what was before and what it will be after, how many patients will you be able to administer treatment to at a single time?
Okay, so currently I think we have about 4 or 5 bays, and we want to basically double that.
Okay.
We want to double that.
Wow. Wow, fantastic. Well, certainly it is an expansion worthy to be experienced and rather than just spoken of. But certainly if you are an oncology patient, and you're a chemotherapy patient, you have any sort of blood disease or ailment, and you are tasked, if you will, to see Dr. Richards, you can guarantee that the environment in which you are making that visit will be as comfortable and as easy and stress-free as possible. We need to pause and take a short break. But there still remains a lot more healthcare today with the HSA and our guest, Dr. Lundie Richards, to come. So don't change that dial, but instead stay with us for more HSA Today with, Healthcare Today with the HSA here on Bobo FM.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
And welcome back, Cayman, to Healthcare Today with the HSA and our guest, Dr. Lundie Richards. We are chatting about the new Haematology, Oncology, and Chemotherapy Centre expansion. So the center itself is not new, but it is getting a much-needed upgrade, and that, of course, will seek to benefit you, the patient, should you ever need to utilize the services of Dr. Richards and the HSA. Dr. Richards, again, fantastic first segment. I feel smarter already. And we continue with the information for our listening audience. World Cancer Day is approaching. Can you share a little bit about what this day means in general, both locally and globally, but significantly what it means for our local community?
Thank you, Austin. Now, the international bodies have really all the time selected different days to celebrate different things as far as health and the environment is concerned. And one of these is cancer. And the importance of this, it's because cancer has been and continues to be one of the important but devastating chronic conditions that people experience. And none of us is immune from having a cancer. And it is clear that when persons know more about a condition, then they're empowered. And if you're empowered, then managing these conditions becomes much better, becomes much easier, even if, and I mentioned, even if the outcome is not going to be that good. But one becomes prepared, they know what to expect, they know what the treatment entails, and it's about us, therefore, raising awareness, providing education, and helping everybody to work together in terms of defeating cancer.
Yes, yeah. There was a time, and I'm delighted to know that that time has since passed for the most part, and that has come with education, the addition of new technologies, and that has produced better outcomes. But there was a time, particularly in the Caribbean, and I use the Cayman Islands as part of that Caribbean, where cancer was quite possibly the worst news that any individual could be given at any point in their life. And many times, just the single mention of the word caused the deterioration of the person in their mind. And we know these days, as we think, so we do. How, in your opinion, your medical opinion, has that viewpoint, and in particular the fear factor surrounding cancer, changed over the years from a patient's point of view?
It's mixed.
Okay.
Cancer is still devastating.
Right.
It's very expensive. Insurance companies are crying.
Mm-hmm.
Governments are crying.
Mm-hmm.
Individuals are crying. Mm-hmm. But the impact on the individuals and their families, it is probably one of the worst. And so once somebody would want to know, they're coming to a doctor, they want to know, do I have the big C? Do I have cancer? Or do I have, I don't want to say that word.
Yeah,
you know, you still have that. Mm-hmm. I do have patients who come in and say, doctor, is this thing gone? Mm-hmm. I don't want to say the word. Mm-hmm. You know, so that tells us that, you know, there's a huge fair.
Right.
But I think there's greater understanding of what it is.
Mm-hmm.
The good thing about treatment strategies, they have improved significantly. I do remember when I started about 30 years ago, there were certain conditions, name them, lung cancer, breast cancer, multiple myeloma, when you looked at the patients and you knew that especially if they had spread early, you knew that their days were absolutely numbered.
Yeah.
No, you can't count the days,
Right.
because our patients are living much longer.
Correct.
Right?
Yeah.
And that is because of the great advances, both in terms of awareness on the one hand, diagnostic methods, screening and diagnosis, as well as the various treatment strategies. Treatments have become more targeted, meaning specifically hitting the cancer where the cancer doesn't like it,
Right.
rather than just a big scattershot treatment.
Yes.
So these have improved significantly, and that's why our patients are living longer and living better lives.
Living longer and better lives, I think, is certainly, the kind of positive news we all want to hear. And for fear of sounding like a broken record whenever having these types of discussions, I believe it is absolutely essential that we cover the next question again for those who still either A, have never heard it before, or B, remain deaf to the reality. And that simply is, in your medical opinion and in your 30 years of experience, when dealing with the big C, how important is early detection?
Oh, this is absolutely critical. Absolutely critical. Early detection. So when somebody comes in with early cancer, for example, early breast cancer, we oncologists, we use a term and we say, we can aim for a curative intent. Right? We're being very careful, because curative means that once treated, then the possibility of recurrence is pretty low.
Right.
Good. And that's why you want to catch it early. Patients who present later on, meaning that they have extensive disease or the disease has spread, then you no longer talk about curative intent. What we talk about, we use the word palliation. It does not mean no treatment, but we know we don't go with that curative intent. And in fact, sometimes we don't even use as many medication and aggressive medication, because the outcome, when patients present at a later stage, the outcome is there's no benefit in doing that so-called aggressive kind of treatment. However, as I spoke earlier on about the targeted treatment and treatments that have become more tolerable, even patients with disease that has spread, many a time this disease can reverse either in total or partial, and patients go on living for extended period without the pain and suffering that in the yesteryears that you spoke about, that people usually think of cancer as.
Right, indeed. Again, you heard the doctor himself, it came from the doctor's lips and not mine. Early detection is critical in determining the outcome, whether it be quality of life or how the physicians address the specific ailment. And I know it sounds like a broken record, but this question was aimed specifically at men. Women know this. Us men, we're a little further behind, on this issue. But it is also a scientifically proven fact that the wider degree of chronic illness, particularly in men, are a lot more significant in this country for the simple reason that we do not take advantage of the services that are available to us.
Men tend in general not to have a health-seeking behavior.
That's right.
Like the women. I think we men believe that we are invincible.
Sure, we
have
have to be dead or dying to see a doctor.
Yes.
But that simply is not the case.
No,
We are all human at the end of the day, no matter how
Correct.
strong you feel.
Correct.
And the message here is men in particular, if you're hearing the message, early detection. And particularly as you get older, 40, 50s and beyond, you may not have had a regular regiment of visiting your doctor, but as you get older, you know that body warranty starts to expire. And with that warranty, as with a car, things break down.
And to add, chronic disease, we'll divert a little bit, it's not only cancer.
Right.
Hypertension,
Yes.
diabetes,
Yes.
and these kinds of things, these come upon us.
Yes.
And when we see a cancer patient, we not only see cancer, we see that person who has diabetes, who has hypertension, who has all other chronic disease. And so we have to look at all of these and tailor our treatment
Right.
based on what the patient presents with.
Indeed. And again, just to divert just for a few seconds longer, I became aware of the chronic illnesses following the last year's health symposium and the report that accompanied that. And it was very eye-opening. It truly was eye-opening in terms of, the realities that were revealed in it as it relates to chronic illness. And so when you hear good news, important news, I think you have an obligation to share it so others may be aware of it.
And just one other thing to add to this. We spoke about early detection.
Mm-hmm.
However, one of the important things that we have to recognize is, are there anything that we can do? Change our lifestyles, healthy eating habits, exercise, enough rest, least amount of alcohol, if you have to touch
Just
it.
take all the pleasures of life away,
Right.
don't you?
Smoking,
Yes.
diet,
Yeah.
all these things come into healthy lifestyle, because the unhealthy lifestyle trigger one or two different things, and it's a whole cascading thing. So it's about a domino effect.
Right.
And one or two of these may make us more susceptible to having either cancer or some other chronic disease. So prevention is even better than early detection.
Yes. Again, thank you for that, Doctor. I think that's valuable information. Back to World Cancer Day and the HSA obviously taking not only notice, but celebrating World Cancer Day. Can you tell us, both from the standpoint of the Haematology, Oncology, and Chemotherapy Centre itself, but also the wider HSA, what sort of events are planned as we recognize World Cancer Day here in the Cayman Islands?
So our main event will be looking at having a broad health symposium where we have different speakers looking at various topics. One of the things, since we're kind of concentrated at cancer, because everybody always asks, or you hear the suggestion, the rate is very high in the Cayman Islands. The truth is that because the registry is a voluntary registry and everybody doesn't have to go in and register, we don't really have the exact figures. However, one of the things that will come to light is, what is the data looking like at this moment based on whatever figures that we're able to pull together. So we expect that to be a very interesting talk. And then we'll be looking at what we at HSA, some of us look at some of the, I wouldn't say more important, but some of the more frequent ones, looking at breast cancer. Everybody knows somebody with breast cancer, colon cancer, prostate cancer, and something that you don't hear about, multiple myeloma, which is a bone marrow disease, but it's very frequent.
I see.
Right?
I see.
And the critical thing about these, as I go back to 30 years ago, people died early from these. Now, multiple myeloma, for example, patients going 7, 8, 9, 10 years. So it's important to recognize that with new treatment strategies, with greater awareness, then our patients can have access to all of these types of high-class, cutting-edge, both diagnostic and treatment strategies to make their lives much better.
Fantastic. We need to pause and take another short commercial break, but there still remains a lot more healthcare today with the HSA to come, and our guest, Dr. Lundie Richards. Specifically, when we come back, the doctor just hit on something rather important, and it's said oftentimes that the cancer registry is voluntary. When we come back, we're going to talk about why is registering yourself and your ailment important in the grand scheme of things, as well as, of course, touching more on World Cancer Day, the events planned, and why this is important for you. So don't change that dial, but instead stay right where you are. There will be more healthcare today with the HSA and our guest, Dr. Lundie Richards, as we talk about the expansion of the new Haematology, Oncology, and Chemotherapy Centre, as well as the events that will be taking place as part of World Cancer Day here in the Cayman Islands. Keep it locked. We will be right back with more healthcare today here on Bobo FM.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
And welcome back, Cayman, to Healthcare Today with the HSA and our guest, Dr. Lundie Richards. I'm your host, Austin Harris, and for those of you just joining us, well, where have you been? We've had a fantastic discussion so far with our guest as we touch on the subject about the upcoming expansion of the Haematology, Oncology, and Chemotherapy Centre here in the Cayman Islands, what that means for existing patients, as well as some valuable information for persons who might have to, in the future, utilize some of these services. The good news here seas. But now in the Cayman Islands, with whether it be the expansion of doctors and specialties, the expansion in technologies, equipment, and greater infrastructure, you don't have to get on a plane to solve your healthcare needs. A lot of these services are provided for us right here at home. And whilst that is good for the individual, it is even better for our support unit, that is our family and friends who are there to aid in our recovery. We were chatting prior to the break about World Cancer Day and obviously its significance here in the Cayman Islands. When we talk about Cancer Day and the HSA in particular, how does this event aim to raise awareness about cancer prevention, which we talked about, early detection, which we touched on, and treatment options?
Mm-hmm. So, thanks again. So the important thing is to provide an insight into the patient journey.
Mm-hmm.
So the attendees will be able to see what happens to a patient and have that vision of how it is, and to that patient, how they become healed, right? And I think that is very, very important, as well as people will understand a little bit more about the different types of cancers that we have and generally how we treat them. But the takeaway from there is really the patient journey. How it's why is this so important? And because at the end of the day, we're here to serve the people, and we're here to make sure that every single patient that comes to us feels comfortable, despite the good or poor prognosis that they may come with.
Right.
But they must feel satisfied and feel empowered at the end of the day, because we give them simple information that are to their benefit.
Indeed. And I thank you for that. As it relates to World Cancer Day, and obviously you're familiar with what will take place at the Haematology Centre itself. But for those who are interested in other events taking place at the HSA as part of World Cancer Day, where would you direct our listeners specifically to gather more information for their own personal edification?
So you just look out because everybody's in social media nowadays, and HSA has its social media network and followers, and there'll be lots of information that will be coming out as to what we expect to see, so on and so forth. So look out for that. There'll be things in the newspaper, things on different radios. So this will be there to provide general information to the public, as well. What we will also do in places where people congregate, for example, our churches.
Yes.
We will have various announcements and small talks, not to take over the sermon from the ministers, but to raise awareness in different sectors because we want to reach as many people as possible.
Quite right, indeed. And certainly we encourage our listeners to be on the lookout for it. As the good doctor pointed out, yes, social media is king in this country, and each of us has a personal handheld device that we carry in the palm of our hands, and that tells us all the information we want to know about the world. Look out for social media. You pick it, your favorite platform. The HSA will be providing information in there. And as he just mentioned, maybe it's a good opportunity for you to visit your local church. I'm sure your pastor would love to see you, and even there, in the midst of God, we will still also provide details on World Cancer Day. So we will square the circle, as some would say, and making this information available to the wider public. Prior to the break, we touched on something. You mentioned it, and Dr. Gent mentioned it back in 2024 when we sat down and had similar conversations. And it struck me as peculiar that it must be a reason for it. We talked about the big C, cancer, of course, but other chronic illnesses, and the desire, I'll use that word, of the healthcare community is that persons with these illnesses, in addition to regular visits to their medical professionals, regular treatments, etc., but it is desired that they register officially on some platform. Now, again, this is not unique to the Cayman Islands. I think it's certainly a global thing. Certainly, I can speak with some authority from a Caribbean perspective that Caribbean people in general are private individuals. And specifically when it comes down to our own physical health, we're even more private. So it's bad enough that the doctor and his nurses know what's broken in me. But why on earth would I want to register on some platform where someone browsing could also find out? Tell me, and more importantly, those listening, why is it important from a healthcare perspective that persons register these illnesses? And when we say register, talk to us about what information is contained in those registries for those persons who are obviously, for legitimate reasons, concerned about their personal privacy.
Okay. So first and foremost, and which we have to hit this one straight dead on, a chronic disease registry or a cancer registry in this case, the only person who has access to this is the person who is legitimately allowed to have it. Okay. This is not a platform like a social media platform where you can go on, right? So nobody has access to it.
Fantastic.
Right? Even us as oncologists, we do not have access to the data on the cancer registry. The only person with access to that is the cancer registrar. Okay. The CMO, Dr. Gent, does not have access to it.
Right.
He can request information in terms of, tell me about the numbers from last year. Are they different this year from last year and 10 years ago? Yes. And that information can be provided in general to the public, say what the numbers are looking like, right? The cancer registrar, at the end of the day, does not even recognize names because these are not names. Each registered individual is a unique number, and it's not your hospital number.
Okay.
It's a unique number that is developed within the registry. Right. And so there's no way in which anybody browsing or even, God forbid, stumbling on this information would have any idea what it means or who any of this information belongs to.
That's fantastic.
So that is the first principle.
Yes. Yes.
Good.
I think that satisfies a great many worries
Correct.
right off the bat.
Correct. Now, the important thing of having all of these conditions registered is that the government needs to know how many people do they were with breast cancer last year, colon cancer last year. What's the prediction for this year or the next 5 years? Because at the end of the day, you have to budget.
Yes.
How do we budget for patients, number of patients going to get chemotherapy, radiation, immunotherapy, and all these kinds of things? So there needs to be an understanding. But that's from a budgetary perspective. But then from a public health perspective, we need to understand, hey, are these numbers going up? What are the environmental conditions that may be predisposing to these kind of things? So the registry provides a whole wealth of information that is, it may not be a piece of information that will directly help one individual, but from a mass perspective and even from a regional perspective and a global perspective to see what's going on. Because when we supply the World Health Organization to say, listen, this is what is happening to cancer in the Cayman Islands, they may be able to say, have you looked at A? Have you looked at B? And that kind of thing. And say, well, you are doing very well in terms of your prevention and so on and so forth.
Right.
So we see how important it is. But I reiterate, there's no way, even if I would bring that information and put it in front of you today, deliberately, that you would understand who one piece of that information belonged to. And no, I'm not going to bring it to you because I don't have access to it. And even if I did, I would not.
Indeed. Well, I thank you for that comprehensive answer, Dr. Richards, because it does satisfy, it satisfies my mind that when we say the registry is 100% private, it is 110% private. It is used for the reasons the doctor pointed out, and again, to sort of bring us back to where we started. The expansion of the Haematology, Oncology, and Chemotherapy Centre may not have been made possible if the doctors and the professionals behind it did not have an idea as to what the trends were in these specialty areas. And certainly we expand because we see the need for these services. And again, this outcome seeks to benefit you, the patient,
Definitely.
at the end of the day. And hence the reason why the registry is important, because it informs healthcare professionals in such a way that the services, again, as we talked about previously, only available overseas, can be made available here
Locally.
in your local hospital, clinic, or otherwise. The life-giving treatments are made available to you with the view of, obviously, you recovering, getting better, or being able to live comfortable, normal lives as a result.
Just one thing, as you spoke about, that persons no longer or with only limited need to go overseas. Part of the symposium that we're having would be a very broad panel discussion looking at various organizations, including government, at with the increase. I personally think there's an increase in numbers of cancers. Yes, that's what I believe. But I'm not the authority, but I believe so. Right. But not only increase, but also with the new technologies I mentioned, new treatment options. The question is access. Because none of these is without cost. Well, somebody who is insured, they say, oh, well, I'm insured. Yeah, but somebody has to pay that insurance.
Correct.
Right? And so the whole question, and then you just go to some of these not-for-profit organizations that help persons with providing for their cancer care,
Yes.
right? Because not everybody has a comprehensive cancer care package. And then one would recognize the importance of having all these organizations. And then we talk about the access to these things. It's all good when you say, oh, yes, this technology has come in and so on. But what about the access?
Quite right.
That is important.
Quite
And
right.
so this symposium, we're going to close that symposium talking about access.
Indeed. Well, I thank you for that. And certainly, again, a little a sneak peek of the symposium that is coming down the pipeline. Also, again, a quick sneak peek at some of the things you will learn when you visit the HSA as part of World Cancer Awareness Day. And again, we have, frankly, Dr. Richards to thank for it, and certainly will be a conversation that I will remember. Dr. Richards, I just have one final remaining question, and that is, as we look at our discussion here today, which has been lengthy but also extremely informative, and hopefully our listening audience would agree with me when I say that, what are some of the key takeaways that you want our listeners specifically to hang on to when they think about our discussion here today, whether it have to be World Cancer Day and the events that will surround it, or whether it has to do with the expansion of the Haematology, Oncology, and Chemotherapy Centre? What are some of the things that you want our listeners most specifically to take away from today's conversation?
Thank you for that. To me, the most important thing for our patients, our caregivers, and everyone to really recognize is that knowledge of cancer is really power, right? And power creates opportunity. And with that opportunity, together, we will successfully at least manage, if we can't beat, a cancer. So for me, that is most important. And we want to foster that knowledge sharing through information.
Indeed.
Good. So for me, that's the most important takeaway as far as we are concerned, either with the center being expanded or through the World Cancer Day events. That is what we're looking forward to.
Fantastic. Fantastic.
Right.
I said the last question, but I think the last question is looking specifically at the center itself. And whilst your patients probably know this already, and those future patients will learn about this, how do persons contact the center? How do persons make appointments? Is that something that is done through the general medical care, and then is a recommendation or a referral, or can persons have direct access to the Haematology, Oncology, and Chemotherapy Centre?
So both.
Okay.
So both. So patients with me walking with a letter from their GP or from their specialist, if they are within the HSA, normally it's electronically done or a phone call is made, or even sometimes patient may themselves believe something is happening and we accommodate them just by walking in.
Right.
Right. And of course, they can call 244-2706, 244-2782, and we'll be willing to answer any questions that they have.
Excellent.
Right. If you allow me, apart from thanking you for this coffee.
Oh, you're more than welcome. Hope you've
It's
thoroughly
been great.
enjoyed it.
Yes, I did. So one of the things that I want to shout out is our staff at our center. We really, really appreciate our staff, our center, our oncology nurses, our business coordinator, our visiting nurses, and of course my colleague, oncologist, Dr. Smelly, who is there. We together, and one person I can't forget is our oncology pharmacist, right, Ramon. Together, this is a team that really, really, really makes a difference in patient lives, because patients knows each of us by name. It's like a family affair when patients come. So I want to shout out the team that I work with, because they're the ones who make patients' lives better. One more shout out, we do have a multidisciplinary tumor board made up of specialists across the system, from psychologists, gynecologists, oncologists, general surgeons, radiologists. together we sit down, we discuss patients, and we come up with a treatment strategy.
Mm-hmm.
I want to thank them, and I want to make a big shout out to all colleagues. Thank you.
Thank you too, Dr. Richards. You are a gentleman and a scholar for recognizing that it is indeed very much a team effort. So too is true in the HSA, so too is true in life. And I thank you very much. I thank you on behalf of our listeners for the information in which you so eloquently shared with us here today, not only about the expansion of the center, which sounds delightful, not suggesting that I'm going to, line up around the corner, can't wait for my opportunity to come in there. But God forbid, if I have to be there, I'm looking forward to attending. I'm filled with confidence that I'm in the right place and I'm in the right hands. And certainly for persons suffering from cancer or anything,
Correct.
that is a huge hurdle to successfully cross. And it is, I think, the beginning of the healing process in many respects. So I thank you very much for being our guests here today, and certainly to our listening audience. Healthcare is expanding all of the time, but the good news is that healthcare expansion, the technology, the outcomes are much more positive today, and they're getting better each and every passing day. And all of these services are available right here at home at your local health services authority. That's all the time we have here for this episode of Healthcare Today with the HSA. Again, I want to express my gratitude to our guest, Dr. Lundie Richards, and his conversation on the expansion of the Haematology, Oncology, and Chemotherapy Centre here in the Cayman Islands, and most importantly for you, our listeners, for once again tuning in to learn more about the services provided by your health services authority. I'm your host, Austin Harris, reminding you to tune in every Friday and Saturday at 1 p.m. for more Healthcare Today with the HSA, brought to you exclusively by Bobo FM.